And now back to Roger Cooper and the American Health Journal.
What if you had early-stage breast cancer and you could have lumpectomy surgery and a full course of radiation treatment all at the same time? We went to Rose Medical Center and spoke with Dr. Barbara Schwartzberg. We asked her about recent clinical trials.
We have two very exciting new projects here at Rose that will allow us to minimize what we need to do to accomplish cure for early-stage breast cancer. Early-stage breast cancer is basically patients who have been diagnosed with breast cancer when it's very small, usually smaller than an inch in diameter. There's just one spot of cancer in the breast. It looks like we can nicely get around it with good, clean tissue and safely complete your cure. Traditionally, that patient has required a lumpectomy where we remove the cancer, and then post-operatively, for traditionally 5 weeks, now more lately for 5 days, they have to go back to the hospital for that entire period of time to get radiation therapy to complete their cure. Our new project now allows us to do that radiation during the lumpectomy in the operating room as a single dose. Once we've done the lumpectomy and confirmed that we're all around the tissue with normal, clean breast tissue, healthy breast tissue around it, we then apply a balloon applicator, it looks like a small water balloon, into the cavity where the breast cancer was just removed. A small tube, an electrode, is passed into that tube and emits for a certain period of time, usually 8 to 15 minutes, a radiation dose. The tube is then removed and the radiation treatment is complete. And that's all they need for their treatment.
The doctor tells us about the recovery after the procedure.
The rehab's incredible. We do it as an outpatient procedure, so the patient doesn't even have to spend a night in the hospital. The procedure itself is done under a general anesthetic, so you're going to be very comfortable and actually pretty much back to normal activity the next day. Done with your treatment.
Another trial underway may lead to dramatic improvements for treatment in the future.
This is a whole different concept. No one likes to have surgery on their breast when they need a lumpectomy. So instead of removing the cancer surgically with a lumpectomy the way we always have, we will treat it with a laser beam. So there will be no incisions. We'll place a laser probe right into the cancer, deliver the laser treatment, heating up the cancer to a certain temperature. Once it's at that temperature, we'll be removing the probe and your treatment will be complete. So actually we have our laser treatment that we'll be working on starting this year. We have intraoperative radiation therapy, which we're already doing now. You can see where this is going. In 5 years, we'll be one of the few spots in the country that will combine these two, where we'll first put in the laser, treat the cancer, remove that probe, put in the radiation probe, treat the cancer. You'll be done, no incisions. It'll be terrific. This is for early stage breast cancer, so we do encourage patients to continue with their mammograms or even a new technique called tomosynthesis, so that we pick up these cancers early with early detections and make them curable with these very easy procedures, as opposed to waiting when it's too late to do this.
For more information on Dr. Schwartzberg or Health One Rose Medical Center, call 1-877-HEALTH-1 or visit health1cares.com.